Hi everyone, welcome to Know Your Coverage, Claim Your Care. I'm Catherine, and today we'll be navigating Covered California under the Affordable Care Act. And this is a simple guide to understanding the Affordable Care Act and how it shapes access to healthcare in California. I'm going to discuss what Covered California is, why it matters, and most importantly, how you can apply and navigate the system with more confidence. By the end of this video, you'll know exactly where to start, what to expect, and how to choose the coverage that works best for you. And as I always like to say, it is time to reclaim your right to health. So what will be covered? One, we will see what Covered California is and what the Affordable Care Act is. We'll also see the impact of the Affordable Care Act, eligibility requirements, and how to apply and choose a plan. We'll also go over enrollment deadlines, cost subsidies, and how to get financial help, and what access to doctors and medications would look like based on your plan. Again, reclaim your right to health. So what is the Affordable Care Act? The Affordable Care Act, which was passed in 2010, is a U.S. healthcare law designed to make health insurance more accessible and affordable for more people. It was created in response to problems like high medical costs, lack of coverage for people with pre-existing conditions, and millions of Americans having no insurance. The Affordable Care Act has helped by offering financial assistance to low and middle-income individuals, expanding Medicaid in many states, and requiring insurance companies to cover essential health services like emergency care, prescriptions, and maternity care. It also protects people from being denied coverage due to health issues and allows young adults to stay on their parents' insurance plan until the age of 26. The Affordable Care Act aims to reduce health disparities and ensure that more people can get the care they need without facing financial ruin. So what is Covered California? Well, it was created under the Affordable Care Act with the goal of helping individuals in California get dental and health insurance coverage from private companies. Covered California costs money, but financial help is available based on your income. Most adults under 138% of the federal poverty level, which I'll go more in depth about, qualify for Medi-Cal, and those above that level typically qualify for Covered California plans. Covered California provides 4 different options to suit people's specific circumstances: bronze, silver, gold, and platinum. Covered California also provides financial help and can lower the cost of insurance. The impact of the Affordable Care Act. To your left here, you'll see a chart, and this chart shows the timeline of the impact of the Affordable Care Act on insured individuals from the year 2014 to 2024. And each color represents different sections of groups obtaining coverage. So blue would be marketplace enrollment, gray is Medicaid expansion groups who were previously eligible, orange is Medicaid expansion groups who are newly eligible, and as you can see, it makes up a huge chunk of each bar, and yellow is BHP enrollment. So in the chart provided, we can see that the ACA has made huge changes, as in 2014, 12 million people were insured, and in 2024, 45 Americans are insured, and that's more than double. So the Affordable Care Act has had a huge impact in making sure that people get the care that they need. And you can take a deeper look into this chart from this website right here below the chart. I got it from the National Institute of Health. So eligibility made simple. Who qualifies? Well, you can apply if you are a U.S. citizen, U.S. national, or a lawfully present immigrant. So a lawfully present immigrant would be, for example, a refugee, temporary resident, permanent resident who has a green card, a non-immigrant with a visa, or a humanitarian immigrant. You can also apply on behalf of a documented family member, even if you are undocumented. For example, an undocumented parent can apply for a documented child. Individuals who are not eligible for enrollment are adults that are not lawfully present. This means that the person does not have valid immigration status. And you might be, however, still eligible for other options such as Medi-Cal. Mixed status households can still apply, as eligibility can differ by person. If you find that you are not eligible for financial help or premium assistance, you can still enroll. You'll just keep the same plan choices, but pay the entire monthly premium yourself. And you may miss out on benefits that lower deductibles and copays. So the main factors that dictate whether you qualify for financial help or coverage are your citizenship and immigration status, as we discussed, Your household income and size eligibility for tax credit or financial help will depend on your income in relation to your household size. Other ways to obtain coverage are an employer plan, which is how many people get coverage, Medi-Cal, and veterans healthcare. So how to choose a plan? Well, you want to start with your budget and look at your monthly premium after subsidies to check if you are able to afford each monthly payment. And step 2, you'd want to pick your metal tier. So bronze is the lowest monthly cost, but it has the highest out-of-pocket costs, as the plan covers 60% of annual costs. And silver, this is the best option for most people, covers 70 to 94% of annual cost, but it will depend on what subsidies and financial help you qualify for. Gold or platinum, you'll pay for more each month, but less for medical services when you need them. So step 3, you'll need to decide your type of network. Health maintenance organization, well, you get lower cost. It's in-network only, and referrals are needed to access a specialist. Preferred provider organization will offer more flexibility at a higher cost, which will vary in and out of network, and no referrals are needed to access a specialist. Exclusive provider organization is in-network only, and no referrals are needed to access a specialist. To learn more about this, you can go on their website, which is coveredca.com, and use their shop and compare tool to see potential costs and what hospitals or doctors are covered. And you can confirm that your provider and hospital and prescriptions are covered. So how to apply, one step at a time. Step 1, you want to gather your documents, your ID, proof of immigration status, social security number, your zip code, and income documents, which can be in your tax returns or pay stubs. Step 2, you want to visit Covered California, the website, which is coveredca.com, to start an online application, which will take about 30 minutes. You'll need to create an account, and you can also call to start an application, which will take about an hour. Step 3, you can complete the application with your information, or if you are applying on behalf of family members, complete it for each household member. You'll have to report income and offers of other coverage, such as employer coverage. Step 4, review your plan and options, and check whether you qualify for premium tax credits or cost sharing reduction. The plan comes in 4 tiers: bronze, silver, gold, and platinum. So enroll in a plan during open enrollment or within the qualifying life event window, which is where you enroll within 60 days of a life event. Step 6, pay your monthly premium after your application has been submitted. This is important because if you don't pay, your application will not go through. And the deadline is typically on the 23rd of the month before coverage starts, and coverage starts on the 1st of the month after you apply. So if you apply on November 1st, coverage will start on December 1st, and you'll have to make a payment by November 23rd. So here are the enrollment deadlines. So it opens on every year on November 1st, and it will close on January 31st. So this is every year. And for special enrollment, so if you are unable to apply during open enrollment, you can apply for special enrollment if you experienced a qualifying life event, which includes moving houses, pregnancy, changing insurance, etc. You can apply any time of the year within 60 days of the qualifying life event. Cost, subsidies, and financial help. So the chart on your left shows the coverage for each tier, which is bronze, silver, gold, and platinum. And each tier provides a different percentage of coverage for each doctor visit, urgent care visits, along with emergency visits. So as discussed before, bronze covers 60% of your cost. Silver covers typically 70%, but with extra subsidies, 94%. Gold is 80%, and platinum is 90%. So to qualify for financial help, your income has to fall within the eligible range based on the federal poverty level, which is about 100 to 400%. You must enroll through Covered California, not directly through an insurance company. You also can't qualify for Medi-Cal, Medicare, or affordable employers insurance. And because the subsidy is a tax credit, you have to file federal taxes. For example, with subsidies and financial help, a silver plan, as I mentioned, can cover up to 94% of costs. Like for instance, a monthly plan may cost up to $400, but with subsidies, you only have to pay $56. So more on that, the federal poverty level, FPL, determines how much financial help you can get. So the lower your income relative to the FPL, the more subsidies you receive. Premium tax credits are lower monthly premiums and are available for people up to 400% of the FPL. Cost sharing reductions are offer lower deductibles, copays, and out-of-pocket max. And they're only for people who are within the 138% to 250% federal poverty level. And it's usually only offered on silver plans. So to know where you fall in the poverty level, you can look at your house size and income, then compare it to the federal poverty level chart. So for example, a family of 3 making $39,000 is about 150% of the federal poverty level. So as you can see here on the chart, it would be right here. And the chart to your left shows your premium tax credit schedule, and they basically cap your monthly premium at a percentage of your income, so about 2% to 9.5% depending on your FPL level. Premium tax credits make your premium affordable by limiting what you pay and having the government pay the difference. So, access to doctors and medications based on your plan, and these are offered under the Affordable Care Act protections. So, due to the Affordable Care Act, Covered California guarantees that having pre-existing health conditions cannot prevent you from getting health insurance. If you're sick or injured, your health insurance plan cannot get canceled because of it. Free preventative care is included in all plans. Until the age of 26, young adults can be covered under their parents' plan, and confidential information will be kept private, which includes your immigration status. So the standard RX tiers used by all Covered California plans, so this is basically how they will cover your prescriptions or medications. So tier 1 is generic, lowest cost. Tier 2 is the preferred brand, mid-range cost. Tier 3 is the non-preferred brand, which has the higher cost. And tier 4 is the specialty plan, which has very high cost medications that need special handling. Costs still vary between plans, so you want to check a plan's formulary, which is the covered drugs list. Bronze plans and some silver plans also have a separate prescription deductible, and some medications have limits on how much you pay per fill. All plan levels from bronze to platinum use this standardized tier system. So you'll be able to see this during the application process. So that is it for today. If you have any more questions, you can always visit their website at coveredca.com. And thank you so much for joining us at Know Your Coverage, Claim Your Care. I'm Catherine Ho, and I'm an undergraduate public health policy student at University of California, Irvine. And as I always like to say, it is time to reclaim your right to health.